very much. Our next speaker is Heather Shanahan coming from Lung Life Pulmonary Rehab. And Pulmonary Rehab is my favorite. I think it's underutilized. I think more people need to know about pulmonary rehab and what pulmonary rehab will do for you, the outcome. And so I'm going to let Heather tell that story.
Hi, everyone.
Hello.
So I'm here to talk about Lung Life, Pulmonary Rehab. We have 2 locations, one in New Haven and one in Branford, Connecticut. Lung Life is a pulmonary rehab program. It's designed to help you take better care of yourself and enjoy your life fully while managing your lung disease. We improve your physical capacity and help you learn about your condition with educational classes, physical exercise, and support. Pulmonary rehab teaches our patients to manage their breathing instead of your breathing managing you. This is a key factor. This is accomplished with all the education classes that we do, and also the group exercises, and just taking charge of your life. The group setting acts as a support group, which we've heard a lot about today, that it really does. We need our community support and also other patients that have COPD. It makes you feel like you're not alone. We do provide a personalized exercise plan for each patient. It's nothing to be afraid of. We work individually. We don't push anyone too hard. Some people are afraid to exercise. They think that they're going to hurt themselves. But really, this is personalized to you and your abilities. Hopefully, over time, we'll increase your strength and your endurance, and then that builds confidence, and you'll feel better, and hopefully break the downward spiral of inactivity and anxiety that comes along with having COPD. So it's a pretty easy process. Taking the first step is just having your doctor make a referral to our program. It could be your pulmonologist or it can be your primary care doctor. You want to have a pulmonary function test, which most of you probably already have one. You come in for an evaluation with myself. I'm a registered nurse. We have a physical therapist on staff who's been doing pulmonary rehab for over 30 years. We'll go over your medications, assess your ability, and do a 6-minute walk to see where you're at physically. Then we would schedule you into one of our 3 classes in our 2 different locations. So we run classes Tuesdays through Fridays. We have a 10:45 to 12:15 class, a 1 to 2:30 class, and a 2:30 to 4 class. So there's lots of different times to accommodate different schedules. You'll participate in the group sessions of education and exercise, hopefully gain strength and endurance, and learn tips to manage your lung disease better and breathe better, and overall just improve your quality of life. We work as a team at Lung Life. We have a great team we have a pulmonologist on staff, Dr. Aiden Pinar, and also Dr. Ernie Moritz. Those are our medical directors. We have a physical therapist, like I said before, Deb Baser. She's wonderful. Myself, I'm a registered nurse. We have an exercise specialist, Roxy, and a wonderful secretary, Barb, who a lot of people will know her name. She talk on the phone, schedule their appointments. And also we have a wonderful volunteer, Mario, who we are lucky to have. He is a former patient of ours, who you'll hear from next. And he really helps our patients feel comfortable, and he's a great asset to our team. So all of us can benefit from exercise. It's going to increase our functional levels. For our patients, we want to increase their balance, decrease their risk for falls, and also increase their mobility. We want to keep our patients moving. That's really what's going to help them to feel better. With the exercise, we're hoping that the patients will have higher oxygen saturations. The stronger you get, the stronger your muscles get, the more efficient your body will be at using oxygen. Exercise improves our blood pressure, it improves our bone density, and it really does improve our overall attitude and mood, which I'm sure most of us can attest to. So we have 2 gyms. Our gym in Brantford, there's just a couple of pictures up here of our gyms. Another thing I wanted to talk about is exercise really does help to decrease anxiety. Our lung population, being short of breath is very anxiety provoking. Pulmonary rehab really teaches you about your disease, and the more you know about it, the better you're going to be able to manage your disease. And other people have said that today, but it really is knowledge. Knowledge is really great. So by increasing your knowledge and your physical capacity, this will hopefully decrease your anxiety and make you feel like you're more in control of your disease. We don't want your disease to be in control of you. We teach proper breathing techniques to help our patients understand what's happening in the body when we become short of breath, and those breathing techniques really do help our patients. We give our patients support, and the group session acts as a support system to them and hopefully makes them feel like they're not alone. So if our patients are breathing better, we hope they're feeling better. When you have anxiety and depression, exercise often seems like the last thing you want to do. But once you get started and motivated, exercise can make a very big difference. It releases feel-good endorphins, natural brain chemicals that can enhance our sense of well-being, takes our minds off our worries, and decreases that cycle of negative thoughts. You gain confidence with exercise as you get stronger. You're going to get social interaction in the group setting, which is great, and help you to cope in a healthy way. Some of the educational classes that we do are the breathing exercise classes like I had spoken about, diaphragmatic breathing, pursed lip breathing. We do a class on medications, proper use of your inhalers. We see a lot of our patients that are using their inhalers incorrectly. We do a whole class on how to manage stairs. Stairs are very difficult for our patients. And energy conservation, how weather affects your breathing, traveling with lung disease, and also how to manage mucus. All different things that our patients can benefit from. We do a lot of education on oxygen delivery. We see patients come in sometimes not on oxygen, that need to be on oxygen. We will communicate with your doctors and also the different oxygen companies to get you guys on the appropriate system. So during a typical class, you would come in, we would take your blood pressure and oxygen level, and we would set up a routine for you for that day. We do 2 pieces of cardiovascular equipment. We do stretching and some resistance training, and then we do 30 minutes of education, practice our breathing techniques, and hopefully have a little fun. So thank you for having me. I have a table over here if anyone would like to come and talk to me.